disease. Now, fibrocystic disease should be divided into two types, non-proliferative and proliferative fibrocystic disease. Non-proliferative usually is characterized by cyst formation with calcium deposition, fibrosis, and adenosis, where there's increased amount of acinar structures inside in the fibrous strands. Here, the acinar structures are sort of almost missing, not many of these. What we observe is mature fat tissue, which is mixed with remnants of mammary glands with fibrous stroma, which appear to be cystically dilated on two layers of cells. By the cut, it looks like nuclear crowding, but it's actually because of the cut, not because of something pre-malignant happening. There is excretion inside of sort of mucinous excrete. And also there is thick fibrosis, which is surrounding the cystically dilated structures. According to the classification, this would mostly be a type of non-proliferative fibrocystic disease. At least that would be morely connected to the depleted epithelial hyperplasia, since cells are appearing a little bit hyperplastic on certain layer structures here. Also, what we observe would be the thick fibrosis, which is predominant. Take a look at these nodules, which are performed around the cystically dilated structures here, 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 here also. And majorly, it's appearing to be looking like this. So it's, according to me, it's more looking like sort of non-proliferative fibrocystic disease with less cystically dilated structures and more fibrosis and fibrous tissue strands which are surrounding these structures here, with mixture of mature fat tissue or cells or mature adipocytes, if you will. Pretty much that's as far as you remember, I told you an abbreviation of this type of disease, which starts from the word coffee, if you will, in Bulgarian. So those are cysts, fibrosis, fibrotic adenosis, sclerosing adenosis, also epicrine metaplasia. Also, pretty much those are most of the signs which you should observe in this type of disease. Would this bring malignancy? That would be the first question of the professor. How do you think? Most of cases, no. Oh, Rachel, you sent me a question about the clinical cases, which I checked out, about acute signs of rheumatic fever, which you mentioned. Let me just take a look at my phone. Which you mentioned that should be carditis, glomerulonephritis, erythema marginatum, and migratory polyarthritis. So, according to me, you're correct. I did not see any features of glomerulonephritis, but I don't know why it's wrong. I will check out whether we could change this one or we could delete it at least, because it's not correct. Definitely not correct. Yes, it's wrongly given. They show about the acute characteristics of the rheumatic fever. And even in the chronic ones, I did not see changes performing as glomerulonephritis inside in the glomeruli. More like hyalinization of vessels, which is not appearing as glomerulonephritis, but as merely characterizations of something very similar to hypertension changes. So yes, you're completely correct. Now, finishing with this slide, may we continue with the next one? We are going to work faster today because we're short in time.